granulomas of ENT organs. No, today we have a specific topic, tumors. No, several words. First, short introductions. Like in all other organs, tumors of ENT organs also can be absolutely different. And clinical picture, symptoms, and treatment depend from many factors. No, first of all, like in all other organs, tumors of ENT organs can be divided on benign and malignant. Так, tumors of ENT organs also, like tumors of all other organs, can be divided on benign and malignant. And it can have different localization. It can have different size. It can have different spreading. It can have metastasis or without this. And clinical picture depend from many factors. It's impossible to explain completely what in this tumor of this organ, these symptoms present, and here these symptoms present. Now, for example, a tumor of the paranasal sinuses, symptoms can depend from type of tumor, from size of tumor, from localization of tumor. It can be small tumor in one part of the sinus, or can close sinus completely. Spreading of the tumor. It can be limited by sinus, or can spread to the outside, to neighbor organs. And clinical picture can be different. And treatment also will be different, dependent from these many factors. And also, no, it's important, and no, I'm sure that you know it. Diagnosis, final diagnosis of tumors, no, which we will discuss today, we can put only after histological examinations. In all diseases about which we talk today, we must do histological examination, and final results only after histological examination. No, here one question present. When we do histological examination, sometimes we do it before decision about treatment, sometime already after surgical removal. No, we will discuss more detail after several minutes. No, and one more part of the lecture today: infectious granulomas. No, infectious granulomas, it means granulomas, it's tumor-like mass which develop in ENT organs. No, we talk about ENT organs. It can be also in other organs, but we talk about ENT organs. It's tumor-like mass in ENT organs which develop due to some infectious disease. No, for example, today we talk about syphilis, tuberculosis, and scleroma. What due to this infectious disease, ENT organs also can be affected, and in these organs, what can development of granuloma of mass like tumor, and sometimes only histological examinations allow to differentiate, to put final diagnosis. First, we will talk about nose. What at this picture you can see rhinophyma. No, we start from rhinophyma because rhinophyma it's even not tumor. It's hyperplasia. No, earlier doctor thought that it's tumor. Now it's clear this is not tumor. No, we just discuss it in this topic, together with tumor. Because this is no additional tumor-like mass. It's a problem of the external nose. It's due to sebaceous hyperplasia of sebaceous glands of the skin of the external nose, and it's typical for more typical what at this age. Hyperplasia of the sebaceous glands, no, start from the tip of the nose, and finally, like you can see at this picture, it can affect completely skin of the, not on the tip of the nose, completely skin of the external nose. Clinical picture is so typical here. What appearance? We can see visually what this is mass on the external nose, like in all this picture. No, and this is only the one complaint of the patient. Presence of this tumor-like mass, presence of this mass on the external nose. During palpation of this rhinophyma, it's soft, warm, and oily because this is hyperplasia of sebaceous glands. If we palpate skin of external nose normally, it's more oily than all other parts of the skin of our body because too many sebaceous glands here. But here, additionally, hyperplasia of sebaceous glands and too much secretion also. No additional examination here, no need to do. Final diagnosis we can put, of course, I told already, final diagnosis we can put after histological examination of this mass, but histological examination we do usually after removal because diagnosis is clear, and if we will do biopsy before operation, it's also problematic. We will take it, it will be bleeding, it will be wound on the external nose. Usually we do it after surgical removal. Surgical removal, this is shaving to shave by special very sharp instrument. Shave. No, because you can see here no pedicle, here what very wide base, and it's important to remove it completely from the external nose. To shave, but by sharp instrument, but we must be so attentive and careful because it's very difficult to find the border between pathological tissue and normal tissue. We should not remove so much. If we remove so much, we will do so aggressive shaving. First, we can traumatize the cartilage. And later, we can get serious problems due to traumatization of the cartilage. And even if we don't traumatize the cartilage, we can remove so much. We should not remove so much because we should not remove the skin completely because cartilage should not be open, cartilage should be closed. Cartilage should be closed by cartilage of the external nose, should be closed by part of the skin. And this part of the skin also important for regeneration because technically operation not so difficult, but very difficult post-surgical period. I think you understand. Look at all these patients. 1, 2, 3. After operation, we get very big wound. External nose, this is one big wound with bleeding, without normal covering. It's open wound and very difficult post-surgical period. Daily dressing, daily cleaning, dressing, and put the antiseptic solution, put the drugs for regeneration, and it's continue long time, several weeks. Here you can see patient before operation. Here patient several several weeks after operation. Another tumors of the nose. I talked already that tumors of the nose, it can be different, and clinical picture also can be different dependent from the localization, dependent from the size, dependent from the histological type of tumor. Now I will show several pictures. In all these pictures, you can see malignant tumors. In all these pictures, here even already later stages of the malignant tumors of the external nose, no, what nasal vestibule, nasal cavity. No, it can be together, nose, external nose, nasal vestibule, and nasal cavity. No, and several words about tumors of nasopharynx. Oh, sorry, not nasopharynx, paranasal sinus. Paranasal sinus. Inside the paranasal sinuses, also it can be different tumors, but we should remember that paranasal sinuses lays inside the bone. All paranasal sinuses cavities inside the bone, and because it's bone, it can be one of popular type of tumor. This is osteoma. Osteoma. This is bony tumor, which can localize not only inside the paranasal sinuses, but what we talk now, we talk about paranasal sinus, bit, and lead